I am a doctor specializing in aesthetic and regenerative medicine. I have the pleasure of inviting you to the Endolift Talks podcast, where we will discuss the Endolift procedure, which is becoming increasingly popular worldwide. You often ask me whether the procedure is painful, and that's a very good question because until last year, the procedure guidelines stated that anesthesia was not necessary for the patient, and instead, we would cool the patient's skin using appropriate cooling devices. When the Endolift X procedure was developed by Dr. Ricardo Forte, a plastic surgeon, we introduced anesthesia. The anesthesia is created by mixing saline solution in the right proportion with lidocaine. As a result, we get an anesthetic that is administered into the skin using a blunt tip needle, that is, a cannula. As a result, we practically completely numb the patient in the treatment area, which makes the procedure painless. Of course, the administration of the anesthesia itself is not very pleasant, but it allows the patient to undergo an almost 45-minute procedure with virtually no significant pain. The anesthesia, which is diluted in saline, also provides proper hydration to our skin. As a result, the heat from the laser passes through the tissues differently, disperses differently, and thus the procedure is performed much more effectively. Therefore, the only contraindication we might have here is a general contraindication to anesthesia. However, after the anesthesia wears off, the patient may also experience some discomfort because, for example, I personally don't like the feeling in my face after dental anesthesia when I lose sensation. But here, it's much more important for the patient to be properly anesthetized.